Oh, hello there. It's Craig Fitzpatrick from Hosmer Chiropractic, and today we're going to be talking about the SI foam roller. So, in order to do this oh crap, I just spilled water all over the floor. In order to do this mobilization, we're going to need a couple of things. One, you're going to need your hips. Two, you're going to need a really firm foam roller. This white pool noodle is not going to mobilize your SI joint. And three, you're going to need a diagnosis from your chiropractor as to which SI joint is tight. You don't want to treat both. You will be unhappy. You don't want to treat the wrong side. You will be even more unhappy. Make sure you listen to your chiropractor as to which side is tight and treat only that side. But at the end of this, we will show you how to scan your SI joint. Scanning is basically a way to determine which side is tighter. Now again, we always want you to default to what your chiropractor has told you to do, but after you've done it a while, you'll be a little bit more proficient on which side's tight, and this can help determine which side needs to be treated, okay? All right, one of the hardest parts of doing the SI foam roller is determining where you need to put the foam roller to get the mobilization. We're trying to target these two bones on the back of our hips, your posterior superior iliac spine, or your PSIS, which is how I will refer to them throughout the rest of this video. So what we're trying to do is we're trying to get those two PSISs, is that the plural version of it, right on top of the foam roller like so. We do not want it on the sacrum, and we do not want it on your low back. We want it on your PSISs. So to get into position, we always start flat on our back with our feet yoga mat width, okay? You don't have to be out here like this, and we certainly don't want your feet narrow. Think about yoga mat width with your feet pointing straight ahead, okay? From here, I want you to brace your stomach like a giant gorilla is going to jump out of a tree and land right on your belly button. Brace this tight, and then we're going to squeeze our butt, and we're going to lift up our hips like this, and we're going to place our PSISs right on top of the foam roller like that. Now, you'll notice that usually your belt line is a pretty good indicator of where your PSISs are. So you may need to pull your pants down, or you may need to even take your belt off. And now I'm exposing a deep, dark secret. Guys, I wear a double-sided belt. Isn't that terrible? Anyway, I'm gonna get that out of the way, and I can even pull my pants down a little bit, just a little bit, okay? We're trying to make this video PG so I can get my PSISs right on top of the foam roller. From here, I'm going to treat only the side that my chiropractor has told me is restricted, okay? So say, for example, it is my left side. If it is my left side, what I'm going to do is I'm going to very slowly drop my left leg out like this. Notice I am not allowing my hips to come up off the foam roller. I am not allowing my right leg to collapse in. I am simply dropping my left leg out, and I am trying to shift about 90% of my weight onto my left PSIS on that side, but I'm not allowing my right PSIS to come up off the foam roller. We good? And ideally, we would want to stay here for 2 to 4 minutes if you can tolerate it. If you can't, you stay on for as long as you can and you call it good, all right? 1 to 2 times a day, okay? And preferably before and after any kind of activity. If you're gonna go running, particularly weightlifting, we wanna make sure that those hips are calibrated before and after exercise. So this is phase 1. Phase 2, if I was treating my left side, I am going to take my right leg and I'm going to move it in towards the center, and I'm going to lift up my left leg and I'm going to cross it over like this in what we call the figure 4 position. I also am going to take the foam roller and very slightly, I'm just going to lift it up on my left side, just a few degrees, and that will allow a little bit more pressure at that stuck joint. The same thing applies here. I want about 90% of my pressure on that PSIS joint, and I don't want to have my right side pick up off the foam roller. So I'm holding there at that site, and I'm going to hold here for about, again, 2 to 4 minutes if tolerated. And of course, if I was doing this on my right side, I would do just the opposite. When you get off the foam roller, oftentimes it's going to be a little bit uncomfortable if you come in with a lot of sharp back pain or you're experiencing back pain. So what we suggest you do is bring one leg up at a time and just give your low back a little bit of a stretch. The foam roller is not going to shoot out from underneath you, especially if you have it placed correctly. And we're just going to hold here for about 20 to 30 seconds. And then when I lower my legs, I want to lower one leg at a time, okay? And then from here, I'm going to brace my stomach again, squeeze my butt, bridge up, and then lower my hips like that. Easy peasy, right? Okay, guys, so when you do the scan, it is the exact same setup for the mobilization. My feet are yoga width mat apart. My feet are pointing straight forward, and I am going to squeeze my stomach, brace my stomach. I'm going to squeeze my glutes, raise up my perfect butt, and I'm going to set it on top of my PSIs, like so. To do the scan, what I'm going to do is I'm going to start arbitrarily with my right leg. If you're a rebel and you want to do it with your left leg, rebel on, rebel on. And what I'm going to do is I'm going to drop just my right leg out to the side, and I cannot tell you how slowly I am doing this. This is glacially slow. This is like watching C-SPAN slow. And now I'm going to drop my left leg open like that. And I'm just going very slow, side to side like this. And what I'm going to pay attention to, the only thing I'm going to pay attention to is which one of these PSISs is more restricted when I drop my leg out, okay? I'm not talking about my hip socket. I'm not talking about pain. I am just talking about restriction. If my left SI is the more restricted side, as I drop that out, I'm going to feel more resistance here compared to my right. So again, if I drop my right out and it's moving correctly, I'm going to feel this bone kind of move. It's almost like it's going to feel like it pushes in a little bit, whereas on the left side, if it was restricted, it's not going to want to move as I do it. That is what we are looking for. People will oftentimes mistake pain, so the more painful side is not always the locked up side. A lot of times it is, but oftentimes what can happen is I can have a locked up left and my right side hurts because that right side is making up for the lack of mobility of my left side. And another mistake people will make is they will assume the leg that can't go down as far is the locked up side. And often that's not the case. Because there's two different joints that are moving at the same time here. Our SI joint, which is a very small motion, and then the hip socket, which is a huge motion. So again, if my left SI is tight, okay, but I have more mobility at my left hip socket than my right, people might sometimes think, oh, okay, well, I can move my left furthermore. Ergo, my right side is tight. And your hypothesis makes sense on paper, but you'd be wrong. And that's okay. That's what we're here for. We're here to help you. We suggest when you're doing the horizontal scan, do 5 scans on each leg. Gotta go slow. Put on some slow jazz. Now, I don't know. Some people don't like jazz. A lot of people don't like jazz. You can put on Zack Snyder's 4-Hour Justice League and just slowly drop each leg. Maybe that will help. I don't know. And then to get off the foam roller, I'm going to squeeze my glutes. Boop. Slide that out like that. If I'm in a lot of pain, you know, I can always do the leg raise first. Hold here for 20 seconds. Slowly lower one leg at a time. And then again, squeeze my butt. Ta-da!